is Dr. Cozy. It's really nice to meet you. I see that we have you in the emergency room today because you've been having fever and chills since you returned from vacation. Where did you travel to? Real quick, before I get too into it, I want to take your temperature. This is a forehead thermometer. It's just going to have it right above your forehead. But is it okay with you if I move some hair out of the way? Thank you. Just want to make sure we get a clear reading. Okay. So 100.3, not too bad. Have you had any sort of rash or bumps that you've noticed? Any sort of skin lesions? How about any nausea or vomiting? Any lower GI upset? How about, have you had any blurred vision? Any dizziness or loss of balance? How about any palpitations, feeling like your heart is racing? While you were on vacation, were you using insect spray? Did you note any bug bites or anything? Okay. How about, did you spend any time with any farm animals? Okay. Did you swim in any lakes or rivers? Did you drink any tap water, any non-bottled water while you were there? Okay. And did you visit any travel clinics or receive any immunization before your trip? Yeah. This time. Okay. So you got your Hep A, meningococcal pneumovax, yellow fever, typhoid VI, and they did give you Malarone. Okay. Did they give you any prophylactic antibiotics to take with you? Okay. Did you use them? Okay. Is it okay if I keep this? Thank you. Just stick this in. Got my notes here. Okay. So, just a sec. I'm just turning this to the exam page. we are going to do quite a thorough exam here, and while we go along, I'm also going to be collecting some culture swabs from you, so that way I'm able to run them stat at the lab and see if anything preliminarily turns up, specifically looking for any sort of bacterial or parasitic infection. We want to catch those right away if that is what's occurring. So this is going to be thorough, okay? At the end of our exam, it is likely I will have you admitted, specifically in case we need to do any further testing, and I'd like to keep you for observation, alright? Okay. So, I'm going to begin. I'm going to look at your eyes really quickly, okay? So just keep them open. I don't need to do anything yet. Can I get you to look up for me? Thank you. Okay, you can just look straight ahead. Okay. And then keeping your eyes open as best you can. Focus on my nose. Let's get a new cover. Someone left an old one on. Your eyes look good. Pupils are equal. They're both reacting to light nicely. I don't see anything we'd call icterus, which would be a yellowing of the whites of your eyes that can indicate something going on with your liver. Okay, so I'm going to take a look in your ears now, okay? I'm going to scoot a little closer here. And you'll feel my otoscope in your ear. Is that okay? Any tenderness or discomfort here? Okay. Your ear looks nice and clear. I'm just going to take a look at the skin of your external ear, okay? So I will be making contact. Is that alright with you? Thank you. Okay. Just need to make sure there's no sign of any kind of skin lesion or bump, rash. And I'm going to check the other ear as well. Both of your ears look good. So I'm just going to use my otoscope again. Take a look inside your nostrils. Okay. So gently, just superficially. Okay. And the other side. Then, can I get you to open for me? Thank you. Just gonna take a look here inside of your throat. Can you say ah? Great. Just looking at the buccal mucosa, which is the skin inside of your cheeks. Looking on the back of your throat. And then I'm going to remove my tongue depressor. Can I just get you to lift your tongue for me? Thank you. A little bit of irritation in the back of the throat that I can see. Just gonna take a quick note. before we move on, I'm going to take a couple cultures, okay? I'm going to take cultures from your nostrils, and I'm going to collect some cultures from your throat. It'll be fast, okay? Promise. Come on. Just wanted to get them labeled with your ID number. Okay. So I'm gonna do your nostrils first. This might tickle just a little bit. Sorry in advance. Going superficially in the nose. Okay. First one done. We're gonna do your other nostril now. So okay. So now I just need you to open. I'm gonna do back of your throat. Be quick, I promise. And this one is actually, we will save this for a little further on in our exam. I was going to say it's actually in case I need to swab any kind of skin lesion that we find. So now what I'm going to do is I'm going to be feeling along your jaw, down your throat, under your arms, down as well as inside of the elbow, right here. And I'm going to have to feel the tops of your legs, looking for any kind of inflammation involving your lymph nodes, okay? And as before, let me know if anything causes any sort of discomfort. Don't be shy about that. So, starting under your ears. Excuse my stomach. Feeling under your arms. This might be a little ticklish. And then inside your elbows. And then if it's okay, your inguinal nodes. Will be fast, I promise. Okay. And behind your knees. Okay. So I do feel some lymph involvement in your clavicle, supraclavicular node right here, as well as a submandibular node right there. You can feel those. I'm going to listen to your chest. Can I get you to take a deep breath in for me? Good. And out. And again, deep breath in and out. Deep breath in and out. One more deep breath in and out. I'm going to listen to your back now as well. I get you to take another one of those deep breaths. Good. And breathe out. Listen on the other side here. One more deep breath in. And breathe out. While I have my stethoscope, I'm going to listen to your tummy as well. Starting with your aortic artery. Okay. So now I'm just going to be palpating and tapping, starting with your chest. Gonna press on your tummy to feel your liver. Make sure there's no enlargement there. Spleen, pancreas. tracers were choosing violence. Alright. So now I'm going to be testing your reflexes, okay? So starting with your arms. Your knees here. Now, okay. I want you to keep your head very still, alright? I don't want you to turn your head at all. I want you to follow my light, just using your eyes. So just like that. Good. And I'm going to cover one eye and do the same. So. Good. And the other side. Excellent. So now I'm going to be using my Wartenberg wheel here. It's a bit spiky. I want you to tell me if you feel it equally sharp in different areas, okay? So I'm going to start here. That's the same as that. Okay. How about is that the same as that? This the same as that, and this the same as that. How about be the most involved. So try to bear with me, okay? So I'm gonna start. Actually, I'm gonna stand up. Start with your scalp here. Do you see a spot that might resemble an insect bite? I'm gonna irritate it just a little to see if I can express some drainage. I know, sorry. Not seeing anything else. So good. Looking along your hairline here. Just feeling for any kind of presence of inflammation, edema. here. Can I have you lift up your arm a little bit for me? Thank you. And the other side as well. You can relax your arms. Just looking at your arms there. Just taking a look at your palm. Can I have you turn your hands over? Just making sure I don't see any lesions on the hand. That can indicate a few different infectious processes. So I need to rule out any chainway lesions or rash on the palm. I do see one spot right there above your knee. I'm just going to irritate it again. Okay. So we're gonna get all of these swabs run stat for bacterial and fungal culture. I'm also going to put an order for a nurse to come in and draw your labs, specifically a blood count as well as your sedimentation rate, which can help us see at what level any infection is in the body, any inflammatory processes. I'm going to be looking specifically for eosinophil count, which can tell us if there's any potential sign of a parasitic infection. Then I'll also be doing a complete metabolic panel to take a look at your electrolytes, your liver function, basically to help us get a clear picture of what's going on. Depending on what those results show, it'll help me decide if we need to run further testing, more specific labs, or not. Before I step out, I do want to get you hooked up to the monitor here. So that we can keep an eye on your blood pressure and your oxygen levels, your heart rate. So this is just going to go around your arm here, okay? You will feel that intermittently tightening. And then deflating. Okay. And then sorry, let me get this unwound so that way there's no kinks in the wire. And this is just gonna go on whichever index finger you choose. Just lightly clamps on. Perfect. Okay. So that is going to be keeping track of your vitals. So then real quick, I'm just gonna take a note here while I have everything fresh in my mind. one more thing I want to do before I step out is take a repeat temperature, okay? So, I'm just going to move your hair out of the way again. Okay, so that's not changed. So then let's get lab orders here. So we're going to do a CMP, CRP, complete blood count, set rate. Let's do IgG, IgM. Code. We want this run stat. It is. All right. So I am going to pass these lab orders along to one of my nurses, and they will come in and get your blood drawn. In the meantime, I'm going to go get your cultures processed. Okay, so we should have those back pretty quickly. Most of the labs we can have back within an hour. The more complicated testing is going to take a little more time, but that's okay. Most importantly, I want to know what your blood count results are. Okay. So, I'm going to also let our charge nurse know that you are to be admitted. So someone will come in here and probably have you fill out some paperwork, get your insurance card, and start getting that ball rolling. Oh my gosh, I'm sorry, I'm a little bit tongue-tied for some reason. It might take a little bit to have you moved upstairs because we have to wait for there to be a bed available, but it shouldn't be too long. Okay. And then depending on how long it takes to get you situated upstairs, I will either come back and visit you there, or I will come back here in the emergency room and talk to you about the next steps once I have some preliminary labs back. Okay. Okay. Do you have any questions for me before I step out? Okay. Well, if you think of anything, there is a call button right there on the remote. Just push it and one of our nurses will come in and check on you, at which point I can be paged. Okay. And make sure you press that call button if you need anything. If anything changes, like you start feeling dizzy, nauseated, anything at all, press that button. Okay. I'll be back soon. Sit tight.